Hi, Thrive community. It is Dr. Brianna Tivy with Thrive Chiropractic, and I am here today to talk a little bit about the differences in phases of care. And what I mean by phases of care is that what we are trying to accomplish with you when you initially come into the clinic is different than what we're looking to accomplish long term. When you first come into the clinic, typically what's bringing you in is something that's bothering you, whether it's headaches, upper back pain, low back pain, and we can lump all of this into what we call symptoms. And what's important to understand is that symptoms are the body's communication mechanism to tell you that there's a level of dysfunction somewhere that the body can no longer manage on its own. So when you initially start care in the clinic, we're working in an active care phase of treatment, meaning that we're working to change these underlying dysfunctions and patterns that are causing you symptoms, that are causing the body reason to have to communicate to you that something needs to change. Once we get through this active phase of treatment and we're getting you feeling better and we're getting that function up to a level that's optimal, then what we want to do is move into what we call maintenance care. Maintenance care is the phase of care where we're trying to maintain optimal function given all different factors like age, lifestyle, and any underlying conditions. Because if we can keep you at that maximum level of function that we've achieved, then you're gonna A, experience fewer symptoms, and B, the body's gonna have to work less hard to keep you at an optimal level of function. So maintenance is important to keep you feeling good and also to prevent bigger issues or injury down the road. So as we're looking at care in the new year and you're setting healthcare goals for yourself, we want to make sure that you're really considering maintenance as an important part of your healthcare goals for the year. Because if we can keep you at that optimal level of function, we don't have to work so hard to dig you out of those holes when they happen. So if you have any questions about different phases of care, or you have somebody in your life who you feel like could use some change, please give us a call or ask questions in the clinic. We are always here to help and want to be part of the team that keeps you healthy in the new year. Be well, everyone. Bye.